Okay, individual palpation video number 1. I've already asked my patient for consent. Consent has been given for all. So I'm going to start at my mastoid process to feel my nuchal lines moving medially and superiorly to my external occipital obtuberance, and to where right below I find my occiput. And at the bottom of my occiput, I start moving down on my cervical spinous processes 1 through 7, bringing me to here, to where I then start my thoracic spinous process 1 through 12, moving further down the spine. And when I hit my T12, I can use that to pull out to my 12 floating rib, which is where I can then count my rib ankles 12 and up. Then, as I turn my subject around, you can start off here for the sternum, finding the manubrium, and working your way downwards. The manubrium turns into the body. Then at the bottom of your sternum is the xiphoid process. Moving further up the body, underneath the chin, we have the hyoid bone. Now moving on to muscles, we start with the sternocleidomastoid muscle, which is extension at the atlanto-occipital joint, flexion of the cervical spine, rotation of the contralateral side, and lateral flexion of the ipsilateral side. Moving here, turning the patient around again, you see the splenius capitis here. And the splenius capitis is extension of the head of the cervical spine, rotation of the ipsilateral side, and lateral flexion to the ipsilateral side. While the splenius cervicis is a little bit more lateral, but it still does extension of the cervical spine, rotation of the ipsilateral side, and lateral flexion of the ipsilateral side. Moving further down the body, we work into the erector spinae muscles. In the erector spinae muscles, starting medially, moving laterally, we start with the spinalis. In the erector spinae spinalis starts most medially to the lumbar region of the spine, and it does extension of the spine, it does anterior pelvic rotation, lateral flexion of the spine and the head, lateral pelvic rotation of the contralateral side, ipsilateral rotation of the spine and head. Moving more laterally, we have the erector spinae longissimus, which does extension of the spine and head. It does anterior pelvic rotation. It does lateral flexion of the spine and head, and it does lateral pelvic rotation on the contralateral side. The most lateral erector spinae muscle is the iliocostalis, which is more out here, and it moves all the way down through the spine, and it does extension of the spine, anterior pelvic rotation, lateral flexion of the spine, ipsilateral rotation of the spine and head. Now moving the patient around again. Turn around. We then do the rectus abdominis muscles, and the rectus abdominis muscles are on both sides. They have lumbar flexion. Both sides posterior pelvic rotation, and on each side they have weak lateral flexion to the ipsilateral side. Then you have your obliques. You have internal and external obliques. Internal obliques are more deep to the external obliques, but the internal obliques, both sides, lumbar flexion, posterior pelvic rotation, but on each of the sides they have separate lumbar lateral flexion to the ipsilateral side and lateral pelvic rotation to the contralateral side. Except the external obliques are a little bit longer and larger and more surface leveled, and they have lumbar flexion on both sides with posterior pelvic rotation and lumbar lateral flexion to the ipsilateral side and lateral pelvic rotation to the contralateral side per each side. Last but not least, I'm going to turn my patient back around for the last muscle, which is the quadratus lumborum, which is found on the posterior side with the erector spinae muscles. The quadratus lumborum has lateral flexion on the ipsilateral side. It has lateral pelvic rotation on the contralateral side lumbar extension, anterior pelvic rotation, and stabilizes the pelvic and lateral spine, and it is found right here. Thank you.